My name is Aoife Dignan, and I am part of the Trainees and Members Committee here in the college. And welcome to the first series of a series of 3 talks about becoming a doctor. So this evening's talk is going to be focusing on the application process to medical school and what that involves. I will give you some information about what will be coming up over the next few weeks later in the evening. Just in terms of a little bit about who I am a registrar, so in the final stages of training to be a consultant in geriatric medicine, also known as medicine of the elderly, general medicine, which is the specialty you come to in hospital if you have an illness that does not require surgery, loosely, and then I'm also currently working in stroke here in Edinburgh. I have to confess that I didn't train in Edinburgh, I trained in Ireland, and so I am going to be as illuminated this evening as many of you are about the process of applying to medicine in Scotland. We have speakers here this evening from St Andrews, Edinburgh and Newcastle, so we'll get a variety of perspectives. Please feel free to pop down any questions as you go on Slido. You can use this QR code here, which will vanish while the talks are on, but return later. And if you go to slido.com and then put in the hashtag RCPE-Schools1, that will bring you to somewhere where you can enter talks or questions about this evening's talks. And at the end, we will work through those questions. You'll also be very welcome to put your hands up and ask any questions that might come to you. We also have Wi-Fi, so there's a wee code up here. It's Chiron 1681 is the Wi-Fi code. So please do make use of that. If you need to slip out to the bathroom, it's just out here to the right-hand side. If you're looking for the ladies, I believe it's straight ahead for the men's. We'll try to keep things moving so that we can spend as much time on questions as possible. The first speaker we have this evening is from St Andrews, and that is Dr. Walmsley, who is going to explain to the process of applying for medicine in St Andrews. Thank you.
Hello, it's lovely to meet you all. So I'm Rebecca Walmsley, and I'm the MBCHB Programme Director at St Andrews, and clinically I'm a GP, so 4 days of the week I'm an academic, and then 1 day of the week I work clinically as a GP. And my talk is split a little bit into 2. So the first bit's about how to get into medicine generally, and this is through sort of a Scottish UK lens. And then the second half is more specific to St Andrews. So what do we look for in St Andrews in particular with your admissions? I'm very happy to take queries and questions. I think we're going to do that at the end as a group. So this may sound obvious, but medicine's a vocation. It's a lifelong career, and you have to really be committed to it. So before you start on what can be a conveyor belt, you do really need to be confident that this is what you want to do and this is the right thing for you. And of course, you can never be 100% certain of that. But do think about what being a doctor actually is, because there are lots of caring professions. So I often hear I want to make patients better, and of course we all do. But actually there's lots and lots of different ways that you can do that. So try to think about what being a doctor is and what that means, and get some experience and do some research before you commit yourself to that. It is also a stepped process to get into medicine. There's various things and hurdles that you need to jump. So being here is a great first step for you to realise what some of those steps actually are. And the Medical Schools Council has some really great advice. So if nothing else, after this session, if you are interested in applying for medicine, go onto the MSc website. I've given the link there. It will walk you through all the different steps. It will compare and contrast different universities and different medical programmes, including their entry requirements, and it will talk you through that route map that I've mentioned. So it's a great resource for people that want to study medicine. And to talk a little bit about the different courses, because it's becoming increasingly complex. When I did it, really there was one predominant route. Now there's a variety of routes to do a medical degree. What we call a standard course is a 5-year run-through course. Then you'll have programmes including Edinburgh, which has an intercalated year. So it's 6 years in total, but you get a Bachelor of Science and a medical degree. And perhaps not so relevant to you here from school sector, but so you're aware, there's also graduate entry programmes where you've done another degree first, and then you go to a specific graduate entry medicine programme and do it in a 4-year time frame. But whether you have that 4, 5 or 6-year route, they all give you an MBCHB, Bachelor of Medicine, Bachelor of Surgery, which sometimes you'll also see as MBBS, which means the same thing, okay? And they're all what's called a primary medical qualification in the UK. They're regulated by the GMC, that's our regulatory body, and that will allow you to enter into hospital training, the foundation years. So after you complete your medical degree, you then do 2 years in Foundation Year 1 and Foundation Year 2, the Foundation programme. So they would all access that. So what is that route map into medicine? So first off, you'll need to have some work experience. You need to have work experience anyway to make sure this is the right thing for you, but we actually require that as part of our application process. We can talk about that. I mentioned how it's critical that you understand what a doctor is and what a doctor does. You also have the hurdle of the UCAT, which stands for the University Clinical Applied Test. It's a test and we get a score, and we base who we get into medical school in part on the UCAT score. And different universities have got different requirements about UCAT, which is on their webpage. You've got the UCAS, and the deadline for medicine's early, and a personal statement within that. And then typically an interview, and a lot of universities now use an MMI, so a multiple mini interview, which is where you rotate around a variety of stations. And then you have to have your grades, your academic achievements. So they're the main parts to it: the work experience, the UCAT, UCAS application with your personal statement, an interview process, and making sure you jump through the academic hurdles. And it may sound obvious, but there's also professional requirements around being a medical student and a doctor. So there are some things that would preclude you from entering the profession, which are rare, but the expectation of professional behaviour is different to another degree that isn't medicine. So we get asked a lot about what kind of work experience do you need. I do not come from a family of doctors. My parents weren't doctors. So you don't have to go and sit in a GP surgery. You don't have to go on hospital wards. If you can get that, great, because it'll give you lots of insight. But if you can't get that, that's fine too. Volunteer at a nursing home or a care home, these kind of voluntary caring type experiences often show, do you have that empathy and caring side? Can you see the greater healthcare workforce? So when you're looking for work experience, don't think I have to go and sit with a GP, I have to go and sit with a hospital consultant. Great if you can get it, but there's lots of other opportunities that are equally valuable. The thing I would say, though, now certainly at St Andrews, is we were accepting virtual experience during and post-COVID, and now we're not. We're now expecting that experience to be in person, whatever it is that you choose to do. The UCAT, this is just taken from the MSc, but it talks about the University Clinically Applied Test. So there is a website there, you have to register. There is a payment for that test. There are bursaries available to complete the test, and the test result holds just for a year. So it says here it's a 2-hour computer-based test that can be taken at centres across the UK and worldwide, and it includes subtests including verbal reasoning, decision-making, quantitative reasoning, abstract reasoning, and situational judgment. And the universities will use your score on that test to determine it. By and large, I say different universities have different approaches, who crosses the next barrier into potentially getting into the medical school. And I've popped the link there. In terms of your personal statement, there's lots of advice out there. So the MSc, again, has got advice on writing a personal statement for medicine, but UCAS has got advice on writing a personal statement more generally So not just for medicine, but for any sort of area. And you can see here things that it highlights. So think about what medicine means to you and express it in your own words. Focus on what you've learned through your experience. Write about the knowledge you've gained about life as a doctor rather than the activity itself. Explain why certain skills are important to a doctor. Write about any outreach activity. Include some information on an area of medicine that interests you and some information about what you like to do in your spare time. And do proofread it to make sure that it's written to a high standard, doesn't have errors within it. I don't expect people to know what type of doctor they want to be. Okay, it's often, I find that generally quite surprising if you know exactly what you want to do at 17, 18. But it is good to be able to express your interests. So now that was more broad. This is sort of specific to St Andrews. So you have to bear in mind all universities will have their own entry criteria. Okay? So they'll be broadly similar, but there will be differences. So St Andrews has a hurdle-based approach. So we don't look at everything all together at the end. If you jump a hurdle, you move to the next step. Okay? So you have the hurdle of academic performance and personal statement and reference. If you jump through that hurdle, we then look at your UCAT global score. We don't have a set cut-off of UCAT for every year. Okay? That varies. Then we invite about 650, the top 650, for multiple mini-interviews. For us, we have 4 stations, each 6 minutes long. And for that, for 2 of them, you'll be expected to role play with an actor. And 2 of them will be looking at other kinds of skills. Okay? Now, for that, we're not expecting any specialist knowledge. It's really looking at common sense, moral reasoning, looking at things through different people's perspectives, rather than can you recall the GMC criteria on X or Y. And then we'll rank based on MMI and dependent on the route that the student is on, be it the Scotland or England route. So that's the St Andrews process. And St Andrews, we offer a 4, 5 and 6-year route, and we also have a gateway programme. So I'm not going to talk about our 4-year graduate entry, but that is in conjunction with Dundee, and it's called Scott Gem. Our 5-year route is relatively new. We're running it for the first time. We've got second years on that programme now. So it's a run-through 5-year MBCHB with St Andrews throughout the whole of those 5 years, getting a primary medical qualification at the end. But we also have our 6-year route, which is our more traditional and long-established route, where students come to us for 3 years, and then they go to a partner medical school for another 3 years. They get a BSc and then an MBCHB at the end of the 6 years in totality. So I say it's becoming more complex. And I'll talk a little bit about the Gateway programme, which is a 1-year pre-med. So that's 6 year, our more traditional offering. That's 3 years St Andrews and 3 years elsewhere. So we've got about 60 on the England route. So they're 3 years St Andrews and then 3 years Manchester or Barts. And then about 60 places on the Scotland route. So 3 years St Andrews, and then any of the medical schools in Scotland, Glasgow, Edinburgh, Dundee or Aberdeen. We've held that route for many years. It performs really, really well at National Student Survey. We're one of the top medical schools, and we get very positive feedback from our partner schools about the training. So this is the new one. This is the 5-year run-through with St Andrews, which is called ScotCom. So it's Scottish Community Orientated Medicine, and that's a combination of both hospital-based medicine and what we call community medicine, which means things like GP medicine, community hospital medicine. So it's about following the whole patient journey in the round, but the whole 5 years is hosted by St Andrews. And then the gateway to medicine. And then I'm going to start to talk about our entry criteria in terms of our grades entry criteria. So our Gateway to Medicine is a 1-year programme that's intended to promote study of medicine amongst groups that are traditionally underrepresented at university. So it's got lower entry criteria in terms of grades, but it's got specific requirements. So applicants must be considered home for fee purposes and meet some widening participation criteria. For that, then at S5, there'd be a minimum of 4 Bs in hires, and that's to include chemistry, and one of either biology, human biology, maths or physics, and predicted at S6 CC predicted grades. Also has the requirements at Nat 5. Okay? There isn't a guarantee with that 1 year that you would then get into a run-through medical programme at St Andrews, but it increases your chances in that if you pass Gateway to medicine and have a good UCAT score and the multiple interviews, the mini interviews, then you would get into St Andrews medicine programme. So that's a gateway to medicine. But in terms of our standard entry, so this is our standard medical degrees, both that 3-year and the 5-year, these are the grade requirements that we have. Now, I know it's a bit dry to read it out, but I appreciate this is very important to people and something we get asked about a lot, so I will just pause on this slide and read it out for you. So for our standard entry at S5, it's 4 A's and a B at higher, to include chemistry and one of maths, biology or physics, and X6 have to be predicted 3 B's at higher or advanced higher. Need biology, maths and English to at least National 5 grade B, and chemistry higher can be sat in S6 but must be sat alongside another science or maths. And remember, there's that UCAT test too. Okay? We have the requirements in A-levels and GCSEs, and we also have requirements for schools that do IB, so International Baccalaureate. If you are wanting to know the IBs, it's on our webpage, or you can ask me, I've got those numbers as well. But for today, I've just presented highers, advanced highers and A-levels as we've got a limited time slot. So these are the A-levels and GCSE requirement equivalents. For those that may have come from more disadvantaged background, be that because they're a carer, a care leaver, or potentially have more socioeconomic disadvantage, and at present we use a postcode area, we do have what's called contextualised entry, which is slightly lower grade requirements. That would be 3 A's and 2 B's in S5, and an achieved or predicted BB in S6, with a 10% uplift on the UCAT score. I say that's written again there for A-levels. So that's some of the dry stuff, but obviously I'm here to represent the school, but I'm the course director, so my sort of baby is not so much the admissions, it's the content of the course. And I really do think at St Andrews, and actually all the medical schools in Scotland, and I'm sure much wider, but they're the ones I'm familiar with, they do really offer an excellent learning environment. So in the early years, it's much more intense than other degree programmes. So you'll have a lot of face-to-face contact, much more so than other degrees. So for St Andrews in our early years, you have about 22 hours of contact time, and that will be a mixture of lectures, practicals, clinical skills, so meeting patients, talking to patients and to actors, and also self-study, guided study. And you can see there a picture of one of our labs. We're becoming more unusual in that we still offer full-body dissection, which is often considered a bit of a unique selling point of St Andrews. There's a picture there of our facilities, and we really do have world-class facilities for dissection. And our clinical skills. So we have multiple rooms that look like hospital wards, and we use these for you to work through scenarios so you can practice in a safe setting. So rather than obviously practicing actually on the wards in the GP surgeries, we have loads of rooms that look like that, and we give you exercises to work through as teams, but also teach you practical skills and procedures. So when you're taking blood and things for the first time, you're not doing it for real, you'll be doing it on a mannequin in a simulation lab, and we do that for all sorts of different skills. We have a lot of teaching in clinical placements, and certainly in the latter years of ScotCom, that's where you'll be based for almost the entirety of the course. So the earlier years will be a lot of St Andrews contact, and the later years will be a lot of clinical placement contact in the NHS setting. Okay? We use a variety of health boards. Our biggest board is Fife that we use at St Andrews because that's where we sit. And we also have placements at Borders and Forth Valley. So that's me coming sort of to the end of my time. So I've just got some pictures to show you now really just of where I'm based. So this is the medical school. So we're lucky we've got a purpose-built medical school in St Andrews. So we have a lovely town, but we've got brand new, or now it's 10 years old, but it's purpose-built premise. The beach, if you like, is just next to where we are, so I can walk there in my lunch sometimes if I'm not too busy. And also you'll see lots of photos of our pier. This is where we have sort of the graduation. You see people walking in the gardens and so on in St Andrews. So I say I'm here to represent the school, so I'm not part of the admissions team, but I can take queries. I've also put the email address there if people do have any more specific queries about admissions based on their own personal circumstance, and also just the webpage there if you want to take a further look. So thank you all for your time.
Thank you very much. We're now going to move slightly closer to where we are today. So Professor Karen Fairhurst and Vasiliki Potitu are going to speak to us about the Edinburgh perspective of applying to medicine.
Okay. So I'd like to add my welcome to Rebecca's, to all of you, and it's lovely to see so many people thinking about studying to do medicine. It's a fantastic career and one we would like to encourage very many people to apply to. So I'm Karen Fairhurst. I'm the MBCHB Programme Director for Edinburgh Medical School, and I'm just really going to be the warm-up act here, because I'm not, similarly to Rebecca, I'm not directly involved in admissions, but Vasiliki, who's our admissions and recruitment manager, is, and she is going to talk to you about the nuts and bolts of the process of applying to Edinburgh. So just a little bit about me to start off with. So as well as being the MBCHB Programmes Director, I'm a general practitioner at Mackenzie Medical Centre. Hopefully none of you are registered there and know me from a different life, but you never know. And I'm also a Professor of Student Learning in Primary Care at the University. So I've got several roles. So one of the things I want to say is that Edinburgh has embraced primary care and student learning in primary care as an integral part of its course. It's obviously a traditional medical school, but it does as I say, embrace primary care. And I think that's really important because in the UK, 90% of contacts with the NHS are in primary care, and only around about 10% are in secondary or tertiary care in specialist settings. And I think that's important when you're thinking about going to medical school, because often it's the opposite way around in learning about medicine. Most of medical teaching still occurs within secondary and tertiary care settings, so within hospitals, and less so within primary care settings. But as I say, there is a push within Edinburgh, but also within Scotland more widely, to have more learning and teaching within primary care settings. So what's medical school going to be like in Edinburgh? Well, I went to medical school in London, so I don't know what medical school would have been like in Edinburgh. I went to St Mary's Hospital Medical School, which is now part of Imperial College, and I went there really with thinking that I was going to be a GP. And why did I think I was going to be a GP? Well, because I'd been lucky enough to be fairly healthy as a child, and they were the doctors that I knew. So that's what I thought being a doctor was. And it occurs to me now that I actually went to medical school fairly uninformed about what I was going into. And one of the things I would encourage you very strongly to do is to make sure you know what you're going into. And that's echoing Rebecca's comment about doing some work experience, but also understanding about caring, and about compassion, and thinking about patients as well as science, and thinking about the role of the doctor and how the doctor fits into a team of healthcare professionals, rather than thinking about the doctor as an individual. Because to some extent, we can only know what we want we can only know that we want to be something if we can see that. So if you've not seen what a doctor does, how can you know that you want to be that person? So get some experience would be one of my big things. And then you'll come to medical school a bit better prepared, because medical school can be a bit of a slog in some ways. Lots of it is really exciting, really inspiring, but some of it is quite hard work. So I think you need to know that when you embark on it, that you really want to get to the end of it and that you want to do the thing that you're preparing for. So that would be my first tip. So on this slide here, there's examples of things that I saw at medical school that I found quite inspiring. So I was taught genetics by a man who was very instrumental in identifying the gene for cystic fibrosis, which advanced genetics by quite substantially and was probably a precursor to our understanding of the human genome as we go forward. So that was he was really inspirational and inspired me. I saw people with some conditions that were really relatively rare that I've never come across again in my career. I saw conjoined twins, for example, and I saw a patient who had neurofibromatosis and what's the condition called? I've forgotten it already. Subacute sclerosing panencephalitis, which is so rare that I can't even remember its name at the moment. These are things that inspired me. But what I've realised as I've gone through my career is it's not those experiences that you have every day. So those are the things that you remember from medical school. But the experiences that you have every day are much more commonplace. And there are the things that are satisfying about being a doctor are the patients that you meet along the way, the patients who have relatively common conditions. So this is a patient of mine, Mary, not her real name. And I first met Mary when she came to see me as a GP with her 15-year-old daughter who was pregnant at the time. So Mary was pretty stressed, not surprisingly, at that time. And I've known Mary subsequent to that, for 25 years. And during that time, she's developed asthma, arthritis, hypertension, depression, and obesity. Now, all of those things are extremely common in the population. But that doesn't make them any less important to Mary. She's also had to deal with her daughter becoming dependent on drugs, having to take over the guardianship for her grandson, who was born when her daughter was 15. And she's also had to deal with his behavioural problems. So there's been all sorts of things that I have supported Mary and lived with Mary over the last 25 years. And it's that relationship that I've had with her, alongside the medical conditions she's had, that I've found most inspiring about being a doctor, the things that sustained me and made me satisfied being a doctor. So I suppose what I want to say is that medical school, you will learn lots of science, but at the end of the day, the job isn't all about science. It's about caring and compassion for patients, and that's what I want you to be sure that you want to do before you apply to medical school. But assuming that you're ready for that, I'm going to let Vasiliki tell you about the requirements for applying to medicine in Edinburgh.
Thank you, Karen. So my name is Vasiliki, and I'm the Admissions and Recruitment Manager for the College of Medicine and Veterinary Medicine. It's great to see so many faces here, and I'm just going to talk you through the admissions process for potential entry to the MBCHB program. So you'll hear now some commonalities that also the previous speaker has addressed, like who are we looking for? So we're looking for someone who has shown an interest and motivation to study medicine, who prizes teamwork and communication skills, has empathy, have had a chance to explore what it means to be a doctor, and as you're painfully aware, they have a high level of academic attainment and likes to do problem solving. If you have any health issues or conditions, please let us know early during the admissions process, because it's not going to affect your applications, but we have to be able to know about this issue so that we can adjust any requirements, especially during the interview process. So these are the standard academic requirements for SQA and GCE qualifications. I'm not going to go through in much detail of these. They are on our website, and they're definitely in our a degree finder in the Edinburgh Medical School. But what I want to say, we also have minimum academic requirements, and these are for our widening participation applicants and especially for the plus flag applicants. You will see that the minimum entry requirements are slightly lower than the standard entry requirements. What we mean with plus flag applicants and flag applicants, these are part of our widening access strategy. So we offer these pool of applicants additional consideration. For plus flag applicants, we give additional considerations in their academic score, so we award them with more academic disadvantage points. We also give additional consideration in terms of their UCAT total score, so we offer them a 10% uplift, and they are guaranteed an invitation to our assessment days. For flag applicants, they have to meet the cutoff score definitely, and we give them additional consideration in terms of academic score and UCAT. For UCAT, we give them 5% uplift. These are just for international baccalaureate and also the entry requirements for graduate applicants. I know it's not relevant at this point, but just wanted to highlight this. This is a very popular question we get asked in our communications and especially in our open days. How do we weigh our applications here in Edinburgh Medical School? So the first part of the assessment process is that we look at your academic score, achieved and predicted, and I have to underline here that we do not accept resits for entry to our MBCHB program. These are 25% of the process. The UCAT score is 17.5%, and along with the UCAT score, it's the situational judgment test band, which is 7.5%. So we bring these three elements together, and then we rank our applicants, and we invite them for our assessment day. And as you can see, the selection day scores comprise of 50% of the process, which basically means that if you are invited to our assessment day, it's all to play for. So I'm going to just touch base here in regards to the clinical aptitude test, or UCAT. So all applicants must take this test in the year they apply for us via UCAT. We have a cutoff score, and for 2025 entry, the cutoff score is 2,450. As mentioned previously, plus flag applicants do not need to meet our cutoff score. Dates for booking tests and preparatory material can be found online, but what I would like to urge you to do is to come and visit us in our upcoming open days and chat to our lovely medicine student ambassadors who can definitely give you tips on how to study and what they did to get their UCAT score that made them successful to get an offer to come and study MBCHB at the Edinburgh Medical School. As you can see here from the information, we accept situational judgment test bandings of 1 to 3, but any applicant, regardless of if they are contextual or non-contextual, if they achieve an SJD band of 4, they are automatically rejected. So although we do not score the personal statement, by writing your personal statement and looking at these key things here, it will bring you into a good stead and prepare you if you are invited to come and join us in our assessment days. So what are we looking for in the personal statement? We're looking for personal qualities, empathy, interpersonal relationships, ability to communicate, career exploration, like examples that have led you to understand why you want to study medicine. And then non-academic achievements, anything that you do outside school that helps you to bring a balance between studying and also having a social life. In regards to our assessment days, so we do not do multi-mini interviews. We call them assessment days, and we invite approximately 750 applicants. We first introduced them in 2020, and for 2025 entry, we're going to do a mix of assessment days. Some are going to be held in person, and some are going to be held virtual. At the end of my slides, you will see a timeline of when we're due to have them this year. Our assessment days are aligned with the core values as they are outlined in the Medical Schools Council document. So this is a very important link that I want you to go and read. And as you can imagine, these are core values that we have already touched in the previous slides. For example, empathy, communication skills, teamwork. I think it's quite sensible to understand that these are in alignment of what we're looking from future doctors. So we have 4 stations in our assessment days, and each station is marked independently by one selector. You have a chance to talk to our medicine student ambassadors that they will be on the day, and they will guide you through the process, and they will be there to happily answer any questions you have about coming to study with us in Edinburgh Medical School. So after we conclude with our assessment day, we review all application scores and we calculate how many offers we're going to make in each fee status category, depending of course on the numbers of places that we have available. You can find this information on our website. We currently don't know the number of places that we're going to offer for 2025 entry. All offers are made by UCAS and are conditional, even if exams are already achieved, and this is because you have to get become a successful member of the Disclosure Scotland's Protecting Vulnerable Group scheme. And as you are aware, we typically have more applications in each fee status category that we have places available. I have here a timeline that I believe you will find useful, and as you can see, the assessment days are going to be held between the months of November, December, and January. And I'm gonna close my presentation now. I'm gonna finish my presentation, and these are some useful websites. The medicine website where you can find all information. That also has information about our curriculum. The admission statistics, that is a very useful site because we do get a lot of questions, especially about UCAT, because it does play an important role in the application process. So we provide admission statistics for the last 3 years. And it's good to see a comparison between its fee status category and how well they did in all the application stages, like from application to invited to interview, get an offer, and then get placed on program. And then, of course, where you can follow us on the social media, especially on Instagram, we have a very live medicine community that they're happy to share their experiences. And that's it for me. Thank you for listening. And if you have any admissions questions, I will definitely answer them at the end. Thank you.
Thank you very much. And so we now move down over the border to Newcastle, where Dr. Alison Graham and Caitlin McElraith are going to speak to us about their admissions process. Do keep those questions coming in on Slido as you think of them, because after this talk we will be moving on to answer those questions either in person if you are happy to voice them in the room or through Slido. Thank you.
Hi everyone, nice to see so many of you here today. So I'm Caitlin McElraith, Student Recruitment and Outreach Coordinator at the Faculty of Medical Sciences at Newcastle University, and I'm joined with my colleague Dr. Alison Graham, who's Deputy Lead for Admissions and Recruitment at the Medical School and also our Widening Participation Lead. So today, firstly, I'm just going to talk about a few general considerations that you might want to think about when applying to medical school. I'll talk a bit more about Newcastle University in particular, and then I'll pass on to my colleague Alison, who will talk more about the admissions process for Newcastle, which I'm sure you're very keen to hear about. So some general considerations you might want to take into account when you're applying for University. For example, do you want to stay close to home? Do you want to move away from home? Is there a particular city that you want to live in that have a medical school, and maybe have a look into that? You'll want to look at the selection methods. So, for example, the UCAT, how important is it to this university? Each different medical school will place different importance on the UCAT score, so it's definitely worth looking at that. And the situational judgment band, each university will use it slightly differently maybe. As for interviews, will they use a multiple mini interview or will it be panel? Again, think about what kind of strengths you have in interviews and look at those different interviews, what they entail and what you would prefer to do. Also looking at the places available and how competitive it is for these places. So really, it's definitely worth thinking about your own strengths and then having a look at different medical schools and see which ones place more importance on your strengths. Some other things you might want to think about is the campus and the facilities. A really good way to view this is by going to an open day. So we do at Newcastle have an open day in this coming Saturday, one in November and a couple in June. But it's definitely worth looking at the different medical schools' websites to see when their open days are, and they might do a virtual one, for example, which may be a bit easier to get to if it's further away, but obviously they are super. It's really good to go to them in-person ones to get a feel for the university and the facilities they have. Looking at the course and seeing the structure of the course, how the teaching is, the different placements you'll be on and where the placements will be. Research, if there's anything in particular that you're interested in, do these universities specialise in this research, for example, and maybe have a look at those universities and again the location. So in particular, medicine at Newcastle. I've got a handy little map here to show you where Newcastle is in the UK. So we're only about an hour and a half on the train from Edinburgh. We are in England, so it does mean that students at universities in England pay tuition fees. So do check the university website for full details on that. At Newcastle, we are a regional medical school, so what this means is that you may be on placements in the Teesside area, for example, which is south of Newcastle. You may be put on placements in Berwick, for example, which is on the Scottish borders, or as far west as Cumbria. I would say this is a huge benefit because you're going to be able to experience different aspects of medicine in your degree here. So, for example, you might be put in a inner city medicine at the RVI, which is our hospital in Newcastle. Or you might experience placements in Cumbria, for example, or Berwick, which is much more rural and has an ageing population. So you're going to see different aspects of medicine, different conditions, and experience all these in your degree. So just to give you an overview of the course we have at Newcastle. So we have our A100, which is our 5-year programme. This will be what most students will be applying to. So year 1 and 2, it's campus-based. Then year 3, 4 and 5 is when you do those clinical, we go to a clinical sites around our regional medical school and you do your placements. We've also got our A101 accelerated programme, which is for students who already have a degree, and for this, it's a 4-year course and you do that extended year 1, and that's the only campus-based year you have. And year 3, 4, 5, again, you'll be in different clinical sites around the region. Some key features of our course, so you can read them there on the screen, but just to delve into a couple, we do use an integrated style of teaching at Newcastle, and what this means is it's case-led teaching. So you'll combine the scientific knowledge with the theory and the clinical practice. It's really good if you're a hands-on learner. It is the style of teaching that General Medical Council recommend, but this isn't to say this is the only style of teaching available. So there is traditional styles or problem-based teaching as well. So it's definitely worth looking at what them different techniques of teaching are and how you think your strengths, how they align to the most, and then look at those medical schools that offer that kind of teaching, and yeah, see what they offer. So with the case-led teaching and the integrated course, what this means is that at Newcastle, you'll take a system and look at this as a whole. So for example, if you take the digestive system, and then you'll look at the physiology, the biochemistry, the anatomy as a whole for this system. So you're looking at it as like a case-led teaching. There's also, in your second year at Newcastle, there is the opportunity to study at our sister campus in Malaysia, which is called NUMED. It's really good if you want to study abroad. It's quite unique to medical schools. Not many offer that kind of opportunity, so it's really worth looking at different medical schools, seeing what your interests are. If studying abroad is something you really want to do, it could be worth looking at different opportunities that medical schools offer. We also have our 8-week elective, which most medical schools do offer in your 4th year, which is where you can spend 8 weeks anywhere in the world studying and practicing medicine. Also, between your 4th and 5th years, you can intercalate. So if you are really interested in particular part of research, typically a lot of students do cancer research, for example, or global or public health. You can spend a year studying and researching this, and you'll get a master's degree after. So it's really worth looking at if you wanted to go maybe into an academic route after medicine and career-wise. Obviously, you're really young, so you might not know yet, but it's worth looking at all these different opportunities that different medical schools offer, and seeing what they do different and seeing what your interests are, and yeah, how they align to that. So I'll pass on to my colleague Alison, who'll talk a bit about the admissions.
Thank you, Caitlin. Hi everyone, so yes, Caitlin said, I'm Alison, I'm the Deputy Lead for Admissions at Newcastle, so I'm just going to talk through the application process that we use at Newcastle. So first of all, how many people are applying and what's the, how many interviews do we do? So we get about 1,500 applications, of which we interview about 1,000 people, and that's for about 340 places in first year at Newcastle. And this is an overview of our admissions process. I'm going to talk through each of these steps in turn, and this is for the A100 course, which is the 5-year course that Caitlin showed you, and I'm going to focus on home fee-paying applicants. I'm also going to focus on applicants who are applying with predicted grades. So of course we accept people who already have achieved Highers and Advanced Highers, or achieved A-levels, or achieved degrees, but I kind of presumed that most people who are here today would be applying with predicted grades, so I'm going to focus on that. And also to say at the very end, I've got an email address. If anybody has got any particular queries about their particular situation or particular qualifications, then by all means email us with your specific query. And we've also got a really good video on our Study Medical Sciences YouTube channel that goes through this process as well, if you want to have a look on there, and it will walk you through that. Okay, so the first step in our process is that we screen for predicted results, and then we score your most recently achieved academic results. So for most people, this will be GCSEs or National 5s or recognised equivalent, and we score the best 8 achieved grades in that. So we have no requirements for specific subjects, we just score the best 8 that you have. And then we also give points to your UCAT as well. UCAT's been mentioned several times today. So most people would sit their UCAT in the summer before applying in the autumn, and we take your overall UCAT test score and award some points to that. And then we add the points from your achieved grades to the points that you've got from your UCAT score, and we rank everybody, we rank all those applicants and invite the top 1,000 to be interviewed. And also to note that we have no requirement for science subjects. So you don't have to have biology, you don't have to have chemistry. Of course, most people do have at least one of these subjects, but you don't have to have them. Okay, so then the next step is the interview. We use multiple mini-interviews, which take place in person on campus. The system we have at the minute is 7 stations that are 7 minutes each. So you see 7 different interviewers. And also at this point, there's an additional score added for your UCAT situational judgment test band. So we heard about this before. So the situational judgment test is one element of the UCAT score, and it's graded in terms of bands rather than points. So you'll get a different number of points whether you've got 1, 2, or 3, and we don't consider band 4 either. So I just wanted to pick up on the interview elements just briefly, because I'm sure some of you are interested in this. So we assess a number of key competencies, which are listed on the right-hand side of this slide, and we ask situational questions about your experiences and behaviours. So for example, we might ask something like, tell us a time when you've worked in a team, or tell us a time when something's gone wrong and you've had to show resilience. And so we're interested in those kinds of things that you've done in the past and how you've dealt with it. And we have no requirement for clinical work experience. So of course, it's really important that you understand what being a doctor is about, but we also understand that it's really difficult to get clinical work experience in some situations. So if you can get it, that's brilliant, and this is the point to draw on it, but we have no requirement for it. But we would also like you to draw on other things that you've done, so other types of life experience, other types of work experience, other types of volunteering that you might have done, and also things that have happened at school or college or anything that you've been involved in. We want you to bring those examples here. And the best advice I can give you about interviews is to think about the type of examples that you're going to use. So the types of things that are written on here are the types of things that you will be asked about in lots of different interviews, in lots of different scenarios as well, not just medical school. But think about, if you were going to be asked about team working, what type of example could you use about that? Where have you used team working in the past? Has it gone well? Has it not gone so well? Or, where have you used your communication skills? And so think about the types of examples that you might use, but don't learn a script, because that can go against you. Our interviewers are very experienced. They can spot when someone is just reciting something that they've learnt by rote. And also, if you've learnt a script, it can mean that you sort of miss the nuances sometimes of what the interviewer is trying to ask you. So think about the examples that you'll use, but don't learn something off by heart so that you can respond better to the situation in the moment. So all of the interviews are scored, and then personal statements and references are checked after interview. So we don't score these, but we do check them. And then offers are made based on a combination of the academic screen and the interview scores. So essentially, the points that have been accrued from step 1 and the points that have been accrued, the points that have been accrued from step 1 and the points that have been accrued from step 2. They are put together and ranked, and then we make offers on that basis. And these are the offers that we give out. So being in England, we work mainly with A-levels, and candidates are applying with A-levels, but we accept a broad range of other qualifications as well. And I've put the hires and advanced hires grades on here, but we accept international baccalaureate, Cambridge pre-U's, Irish Leaving Certificate, all kinds of qualifications, and those equivalencies are on our website if you want to check them. So you'll notice here that we have 3 types of offers, so they fall into 3 groups. And the last 2 on here are widening access groups. So I just wanted to mention a couple of our widening access routes as we get towards the end. So Newcastle University is committed to widening access to the medical profession. And all of our A100 applicants are screened to see if they meet certain contextual criteria. So A100 is the 5-year programme, and we look at every application to see if they meet certain indicators of disadvantage. And if they do, those candidates might have a lower academic screen, an offer threshold, and a lower offer as well. And then I also wanted to mention our university-wide widening access programme, which is called Partners. So this is a scheme that you apply to, and you can check your eligibility on this website here. And you go through a very similar process to the one I've just described. But the key point is the offer is lower. I've got the A-level offer out here, but there's obviously equivalents as well. But this offer is dependent on you completing a summer school in the July prior to starting the course in the September. So that's the big sort of difference here. So just to reiterate that, the contextual offers, they are checked automatically. You might not even realise that's being done. Whereas with Partners, it's a scheme that you apply to. You get a lower offer, but it is dependent on you doing the summer school in the July. Very briefly, the process is slightly different if you're applying to A101, which is our 4-year programme for graduate entry, and for international applicants. The main difference is that in the academic screen stage, we score the UCAT alone. But as I said, there is also a video on our YouTube channel that goes through international applications as well. So just some final thoughts. So you're doing absolutely the right thing by coming to this kind of event. Get information, think carefully about where you want to apply. I just put a small caveat on that, in that I've seen some fora online where they talk about entry to medical school, and I'd maybe be a little bit cautious with some of that information. You know, I've read some things about entry to Newcastle Medical School where I'm kind of thinking, how do you know that? and I know it's not quite right. So be quite cautious, especially as the process that I've described for entry to Newcastle this year is a new admissions process. We've brought in a new processing for the admissions. So anything that people might have experienced previously might not be relevant for the process that we now use. So take some of what you read with a pinch of salt. And the key attributes that we're looking for is a strong academic background, because it's a demanding course. So we're looking for people with a strong academic background, but not necessarily always top of the class across everything you've ever done academically. One of the reasons that we award points for different things is to spread people out so that we can have quite a fine-grained look at different people's achievements. But you do need to be quite solid academically. We're looking for people with a caring nature and the right temperament as well for going into a career that involves working with people. And also motivation and dedication. It's not just about getting into medical school, it's not just about getting through medical school. It's a very long course, it's a long career, so we want to make sure that you are able to get through that and are there for the right reasons. So thank you. So if you want to follow up, that's our email address that you can contact us on. Drop us a line. As Caitlin said, we have an open day on Saturday, so feel free to come along to that as well. So thank you, everyone.
Thank you very much, and thank you to all our speakers this evening. We're going to invite you all to come up and join us here as we answer questions. Logistically, if anyone would like to ask a question, if you just come up to any of the microphones at the end and press the wee button, and then we'll be able to hear you. If you'd rather not, please do give us some questions on Slido. I am poised and ready to convey them on your behalf. While everyone's coming up, just a little bit of information about the college. So the college exists historically to promote the science and the art of medicine and also preserve some of the history of medicine. I'm part of the Trainees and Members Committee, and we're a group of doctors in the early stages of our career who work together to provide some educational resources, organise conferences, and also to advocate for junior doctors at early stages of their career in terms of optimising our training. And part of what we do is we develop podcasts. So if you look on Spotify or wherever you get your podcasts, we have a series of podcasts called Clinical Conversations and Career Conversations. And you might want to dip in or out of several of those. You might find some topics that might be useful if you're trying to think about what does a career as a doctor look like and seeing what might appeal to you. Or for any teachers who are with us today, I know Daisy and her team have a lot of resources available to support schools in their study of various topics and has some boxes which sounded very exciting, which can go out to schools as well. Over the next few weeks, we have some more talks. So next Monday, again, at the same time, same place, there are some speakers going to be talking about their pathways through medicine and their clinical careers. And then next Wednesday, on the 2nd of October, we have some more conversations about ethical dilemmas in medicine, which are obviously useful to ponder as you approach a journey to medical school. So we have had a few questions coming through, and we're obviously keen for more. Thank you. We have a question on Slido asking what types of medical conditions you should inform the universities about when you're making your applications.
So for Edinburgh Medical School, so we ask this at the stage of interview if you get an offer to come in and do an assessment day. So we do ask if you need extra time, especially during your interview, so that we can make adjustments. We normally give like 3 or 4 minutes, depending on what we see as evidence from the school. This is what we ask. So we contact the applicant that they have told us that they want to have extra time in reading and writing, and then we ask for the school to get in touch to just give us more of this information, and then we make adjustments. Then this information also can be collated at the point of offer making, and should you become firm with us, then before the welcome tick, your student advisor will get in touch with you and see if you need any further adjustments. Okay?
Can I just add?
Yes.
I think you should let us know generally about any illness or any condition. there is no condition that I can think of at this stage that would preclude you from doing medicine, which I think is the important thing. And the reason to let us know would be so that we could make appropriate adjustments and offer appropriate support. So you shouldn't have any, I know it's difficult, it's your information, but you shouldn't have any qualms about letting us know about any condition.
It's kind of your careers as well. I've got colleagues with lots of different adjustments that will happen behind the scenes. One question that I think might be a challenge for many people is that it can be difficult to find experiences of shadowing clinically. And does anyone have any advice for people in that situation? I know in Newcastle you've highlighted that you don't require clinical experience in your applications.
Yeah, and similarly, when I talked about sort of getting work experience, that doesn't have to be work experience in a healthcare setting, but it is helpful if it's work experience in a caring setting of some description. And that's when I talked about volunteer work can really be quite a powerful thing that's often accessible. But certainly, I mean, my work experience when I was a medical student, I went and did the bingo at the local nursing home, which wasn't medically orientated particularly. But it did count as work experience, and I did get a sense of how the nursing home operated and some of the needs the clients had. So things like that can be really powerful, but we've had people who volunteered in the charitable sector, nurseries with young children can be a bit more challenging, but certainly nursing and care homes have been really valuable experience. So it doesn't have to be your classic sitting in with a doctor. That's becoming increasingly difficult for everybody to access. So don't worry, you won't be disadvantaged if you don't have that. I don't know if anyone else has got anything to...
Yes, I agree, definitely. So we do acknowledge that you might find difficulty in securing even a shadowing, like a few hours in a GP practice. If you manage to do so, that would be brilliant. But then, yes, you won't be disadvantaged in your application. What I would say is that we always advise our applicants, especially during our open days, that we value quality over quantity. We value what you're going to put in your personal statement. Then if you get invited to our interviews, your reflection on any type of experience you have, even a bad experience, anything that will show your empathy, your communication skills. We do see applicants that they've come in and said, unfortunately, I couldn't find a shadowing experience for this and this reason. And they have, though, read books, they have read articles, they have reflected on what they have read, and they have contextualized it, and also they have listened to podcasts, which is quite popular these days. So yeah, I think everything works as long as you can put everything into a context.
Sorry, I was just going to say the exact same thing about how yeah, like books and podcasts and other ways of finding out information about what being a doctor is like is valid as well as my experience.
Perfect, thank you. Someone else has said that for situational questions, or I suppose interview questions, can you give examples of your experiences from school?
Oh, is that the question?
Yes.
Can you give examples from school? Yes, you certainly can at Newcastle. I think sometimes people seem a bit reluctant to draw on school, and you can see the cogs whirring in people's minds thinking, what can I possibly use as an example? And you sort of think, well, you must have done a group project or something like that. Yeah, so you can absolutely draw on school experiences.
And I think the next question we have is, what age should I know what to specialise in, and when is too late to change? Yes, please.
You certainly don't need to know at this stage. You almost certainly don't need to know by the time you're qualified. Lots of people then go on to do their 2 foundation years and still don't know, and will take some time out, do a bit of career exploration. I think you know when you know, essentially, and I don't think you should feel any pressure to make a decision.
I've met some consultants retraining in different specialties as well over the past few years, so it's never genuinely too late.
I mean, I totally really changed my career about 10 years ago, so in my 30s. You know, I was a full-on GP, and then I became an academic, and now I've got a portfolio career, and that's not unusual at all. So a lot of people do that. I think after FY, the system nowadays does sort of almost force people a little bit to specialise earlier than they used to. But equally, there are lots of different opportunities out there, and you can change your career progression. But certainly at your point, if you're desperate to be sometimes people do just have this urge to be a surgeon or to be a clinician or whatever it may be. If you have that, then that's fine. But I think that would be more unusual than usual. And people change their minds at all different points in their career, and that's fine. That's the good thing about medicine. There's loads of different avenues out there.
Sorry, can I just add? I think there is potentially a danger, but if you go into medical school thinking you want to be a particular type of doctor, and then you get disappointed when you encounter that particular specialty. So I think the important thing is to have an open mind and not to be too focused. I think you might have some preferences, things that you think you might prefer, but really have an open mind and embrace all of the opportunities that medical school offers you.
Quite a practical, but I think probably important logistical question is, do you need to apply for Disclosure Scotland yourself, or will the university help with that process?
So this only happens at the point of offer making. So if you're successful to receive an offer from us and you become firm with us, then we send you your offer letter that outlines the conditions of offer. And this is where we outline what you need to do. It's a very straightforward process. Yes, unfortunately, you have to pay for this. It's not very expensive, and you get information at this stage. You just receive, we put your data in the system, and then you receive a link where you have to click on this link in 14 days. And again, you have to also put some data for yourself, and that's it.
Brilliant, thank you. And I presume that's a common system across the medical schools. I suppose in England it might be slightly different, but there's similar concept. Does it give you an advantage if you take an extra subject at hires?
No, it doesn't at Newcastle University. So, yeah, obviously if you can talk about that in your personal statement or in your interview, it may sort of benefit in that way, but actually for the admissions process, no advantage there.
No, we're the same. If you hit, because St Andrews is slightly different, we don't look at everything all together at the end. You jump a hurdle and then you get to the next hurdle. So if you've jumped the academic hurdle, you just move to the next point. So if you've hit those minimum requirements, then it would go to the next hurdle.
Perfect. Was there something?
No, it will not make you more competitive if you get more higher subjects or more than 2 advanced hires when you're in your S6 year, as long as you meet the grade requirement, the subject requirement in one sitting.
And I have 2 questions that I think are a little bit interlinked about the Scottish medical schools. Are there any important things that English students should consider if they were applying to a Scottish medical school? And are Scottish students favoured over English students in applying to Scottish universities?
Medicine is a control subject, so we have specific number of places for each fee rate. So we have to meet this number of places, and we have to make offers according to this number. So we don't favor them over, but we just need to meet the number of places.
Yeah, I don't think we have anything to add. The route you're on does make a difference. And it's not in terms of competing, it's in terms of the number of places that we've got to fill. And also for our BSc, remember that was that 3-year plus 3 years somewhere else. It will matter whether you're Scotland route or England route and your fee status. So that's sort of government level decisions about how many places we have for various routes. So they're not in competition, but we do have places to fill.
This is a specific question about how does LEAP's transitions get viewed in S6?
So for the Edinburgh Medical School, this is one of the programs that we accept if you're under the contextual admissions policy. So we accept the LEAPS transition program in place of an SQA hire at grade B, but this LEAPS transition program should not be in place of a required subjects. And you must probably be aware that we have required subjects for the Edinburgh Medical School, and this is chemistry and biology, definitely with stronger preference in chemistry.
Thank you. Does anyone want to add? After you graduate and go on to do a specialty, there's a question about whether does SAS still pay for it. I can perhaps help clarify this if that's okay. So once you graduate as a doctor, even when you're working in the foundation programme, you are no longer a university student and you are employed as a doctor. So there isn't a specific fee that you pay for working in the foundation programme. There are costs associated with being a doctor, so you'll have to pay for your registration with the GMC, you may have to pay for medical indemnity, at various points in your career you may have to pay for exams or for portfolios as part of your training, or for specific courses as part of your training, and some of those you may get funding or reimbursement from your training programme or employer. But you move out with the university system at that point, and you're employed as a doctor within the NHS. So you don't need to worry about kind of how your interactions are with the funding system at that point. There are standardised pay scales in each of the 4 nations, which do differ between the 4 nations, but there'll be lots of information available to that about that for you at the point at which you're applying for foundation, and the BMA and other places always are happy to provide that advice, but that is all publicly available information about what the salary scales are for resident doctors. One question here is what books or podcasts might you recommend? And I suppose if anyone in particular has a book or podcast that they might recommend about what they found useful in their understanding of what it is to be a doctor. I can selfishly recommend again the Clinical and Careers Conversations podcasts that we make in the college. In terms of books, I'm sure many of us have read different books which have shaped our experiences and our careers. But go ahead.
I'm not going to recommend any book. I think it's not about what book you read, it's about what you make of that book and your reflections upon it, and the impact it has upon you. So it's not what you've read, it's about what you've understood and what how you've reflected upon it, I think would be my comment about that.
And sometimes that can be literature about people's experience of being patients as well as experience of being doctors as well, and what you reflect and take away from those experiences. In terms of the more questions, do you look at all of the do you select all of the standard requirement applicants and then look at adjusted entry applicants, or are those things happening simultaneously in the application processes?
So those will be happening simultaneously at the admissions process. So Alison mentioned for Newcastle, for the contextual offers, you might not even know that you're eligible for one. So our admissions team would look at contextual data in your UCAS application and make an offer judged on that, but that'll be happening at the same time as standard. Obviously, we have our partner scheme as well, which Alison mentioned, and for that you do have to apply for partners and complete the summer school, but that is a bit different from the contextual offer.
Yeah, just to build on that, we essentially have sort of 2 pools. We have a contextual pool and then a standard entry pool, and the contextual applicants are compared against other contextual applicants, and the standard applicants are compared against other standard applicants. But they are happening, as you say, simultaneously.
Perfect, thank you.
We look into them at the same time, both the standard, like the non-contextual and the contextual applicants. It's just for those that they are in the SIMD 20 quintile, we have 25 places on top of the places that we have for our medicine course. And as I've mentioned in our slides, they are guaranteed an interview. So, yeah.
And a specific question about Edinburgh Medicine that quite a few people have been interested in is, for Edinburgh Medicine, are bands 1, 2 and 3 in the situational judgment test kind of discriminated between in terms of the points that go towards them, or is it just that bands 1 and 2 are preferred, it says here?
Yes, we do award them different points. So definitely band 1 is more competitive than band 2 and 3. So for example, we give like 6 points for band 1, 4 for 2, and 2 for the third band, if that helps.
several people have asked the question about whether there's a specific disadvantage attached to private school applications, or whether it's just managed. No, that's unanimous.
Yeah, no, there's quite a bit of media on this, but it's not the case. We're not disadvantaging against private schools, but we do have widening participation schemes. We do have contextualised entries, but no.
There are a lot of questions about how to sign up or find out about all of the university's open days or insight days. Does anyone have any more information?
Definitely the university websites are the best place to look. We have our ones published on there. You can register to come and find out. Like, you'll get a bit more email communication beforehand, but you don't actually have to register. You can just turn up on the day. It's definitely worth looking at the different medical school websites for when their open days are, because ours are in person, like I mentioned on the presentation, and we have one this Saturday, one in November and a couple in June, but that will differ from medical school to medical school. But they're a really good way to get a feel for the campus. You'll be able to talk to like current medicine student ambassadors, which is so invaluable to hear their experiences. And you'll be able to see like the facilities and stuff, so it's definitely worth going to the ones that you can.
Yeah, no, I agree. I think it's really invaluable. The only sort of add-on for us at the minute, because ScotCom, our 5-year run-through, is a relatively new course. We're doing online question and answer sessions specifically for that course, so that we can answer questions about it. So we've got the open days running, but then we've got these online Q&A events. But all of that you would access for the University of St Andrews web pages.
For Edinburgh Medical School, you can register and be on the waiting list for when we release our events, and this is through the main web page, and it says undergraduate study with us. And we now have the October Open Day. So on the 5th of October, the Open Day is going to happen in Chancellor's Building, which is in the Royal Infirmary of Edinburgh. And what we normally offer in our Open Days is student chat shows. We offer problem-based learning sessions where you can see live actions between a member of the curriculum team with a scenario, and also student ambassadors doing role-playing. We offer pre-recorded talks that also include admissions and curriculum. And we also offer clinical skills tour, again led by our student ambassadors, where you can always just chat to them and see what's happening. These are very popular days, especially the June and the first day of October, the first time in October. The second time in October, which is the 26th of October, it's happening in the central campus area, where you can come and talk to us about admissions. And then we also offer student chat shows and pre-recorded curriculum and admissions talk.
Thank you. Yes.
I just mentioned something else that you can sign up for at Newcastle. So at Newcastle we have this thing called Mini Medical School, which is a series of lectures and talks by clinicians and scientists about their research in medical sciences. And for the last couple of years it's been online. I think they might be going back to some in-person sessions.
They're all in person except from the final one, which is
right.
more of an applied tutor.
Right, okay. Yeah, so you can sign up to come to these lectures in person, or as Caitlin says, the last one is about applying to medical school, and that's going to be online. So again, that's the type of thing that you could get involved in, that you could draw on in your interviews, if you hear something that particularly resonates with you.
So can I just quickly jump in?
Definitely.
So with the Mini Medical School, I should have said as well, they are in person, but they're live streamed, similar to today, so you can view them online as well. And the recordings are posted to our YouTube channel, which you can see previous years as well. We do have a STEM newsletter for both teachers and students, so you can find how to subscribe on our website, and it's definitely worth subscribing to that. You can see any new and upcoming outreach events we have in STEM. So yeah, I definitely would recommend signing up to that.
I'll take another question from Slido, and then we'll move back to the room. We have a question about whether a criminal conviction, perhaps for stealing, if you were, say, age 13 or 14, would that be a complete bar on ever applying to medicine, or whether the context and situation since then would be taken into account?
If a conviction is revealed, then what we normally do as admissions is that we speak with a medical teaching organisation where we seek advice. So to be fair, I'm not sure what would happen in this case. don't know. But if you want to discuss something, you can just email us and we'll definitely get the answer for you.
Yeah, I don't think we can give a blanket answer without knowing the detail, which obviously we can't talk about here. So what we would do is we would view that on a case-by-case basis. So if there is something specific to you, email into the med admissions teams, whichever medical school it is. They would then be able to seek advice. We've got fitness to practice teams within medical schools about whether people are fit to be medical students and ultimately fit to be doctors, and we would have to take advice. So it doesn't necessarily mean that you're ruled out, but I wouldn't be able to say. We would need to know the circumstances and get advice.
Brilliant. So I think that the bottom line is to just, if you do have a question about a specific circumstance, please do contact the universities so that you can make a decision with them. Are there any questions from the room at the moment? Go ahead, please. If you'd like to come up to the microphone, that just means...
Okay, I've got quite a loud voice. Teacher. So I'm head of careers at my school, Kelvinside Academy in Glasgow, and I'm also partially sighted. And I don't imagine I'll have many applicants or students that come to me over the next 10 years, whatever, that are actually partially sighted like me or indeed blind. But have any of you got experience of someone that is partially sighted or blind becoming a doctor? What sort of advice could I give to someone that is in that situation?
I'll just repeat that for people who are online. So the question is about whether being partially sighted or blind might be a barrier to becoming a doctor.
Well, certainly no. That is not something that would preclude somebody entering the profession. There's reasonable adjustments for a range of conditions, and reasonable adjustments would be made. So I can certainly think of people with visual impairment, hearing impairment, and wheelchair users that we've had studying medicine within St Andrews. So all with different circumstances. But the GMC is very clear that we should be supporting people quite rightly into the profession. So it would be more a case of what adjustments we can make for that individual.
A question that occurred to me, if it's all right if I join you with the question, is that a lot of the medical schools, you mentioned having a variety of regional placements, and it might not be something that you initially think about when you're applying to medical school, but obviously sometimes going to regional placements obviously brings great value, but can bring costs and logistical challenges. And how do the various medical schools support that for their students? Yes.
So we're talking mostly about clinical placements in the clinical years. So in Edinburgh, we would routinely place students in Lothian, in the Borders, sometimes in Fife, in Forth Valley, and occasionally further afield in Dumfries and Galloway. So for some students, that represents a challenge, and there are reasons why we would allow students not to be placed in what we would call peripheral placements, but there would be criteria. So, for example, if you had caring responsibilities in the city, we wouldn't expect you to go to Dumfries and Galloway for something and leave the person that you were caring for. So there are reasons why we wouldn't place people outside of a central location. If you are placed further away, and you're quite right, it sometimes attracts costs. So there is reimbursement of travel costs. And accommodation is usually provided, so students shouldn't be out of pocket because they've been placed away from Edinburgh in our case, or away from centrally. I don't know if that's the same for Newcastle.
Yeah, so in Newcastle we have a zonal system, so we have zones 1, 2 and 3. Zone 1 is Newcastle city centre, zone 2 is commutable from Newcastle, so somewhere like Sunderland, and then zone 3 is further afield, somewhere like Middlesbrough, where we would recommend that you get accommodation at that site. And in each of years 3, 4 and 5, students are in one of those zones. So by the end of your 5-year degree, you will have been in zone 1, you'll have been in zone 2, you'll have been in zone 3. It's just the order that you do that is different for each group. But students are told in year 1 which order they will do that in, and they rotate with their group, their sort of learning community group that they have in first year. So there will be some people that you know as you go through, and you can plan ahead because you know where you're going to be in years 3, 4 and 5. Yeah.
Thank you. In terms of foundation courses, some of the universities have them, but there's a question about specifically Edinburgh not having a foundation course, and whether if you've done a foundation course elsewhere, you can use that to apply for Edinburgh.
Unfortunately, we do not accept foundation programs for entry to our MBCHB program. So.
And we also have a specific question about whether any of the universities accept a virtual work experience.
Yeah, we would accept that.
And at the minute we wouldn't. So we've moved to everything being, and I think this is the thing, we're representing, but as you're seeing, there is a lot of variation within the sector. So it's really important you do research around the medical schools you want to go to, so that you don't think that you're ticking a box when actually you're not. So we don't expect it, as I mentioned, to be in the hospital or GP setting, but we do expect what experience you have to be in person. So at the minute, podcasts and reading and things, we would say that would be really informative and help with you to reflect, but St Andrews wouldn't accept that as work experience, and it's right at the minute.
Yeah, and so, and having said that, so virtual work experience would be really good for you, but if all you've done is say that you've done it, that wouldn't like add to the application process. You know, you would need to, in an interview, for instance, draw out why that was important, what you learned from it, what might change going forward, and so on. It's not just the fact that you've literally just done it, it's what you get from it that's important.
Thank you. I think we've got some slightly related questions about if you apply for any of the universities through any of the widening access programmes, will that have any bearing on your university career thereafter? And also some questions about whether any scholarships or bursaries are available to medical students.
So, yes, so scholarships and bursaries are available. I'm not quite sure, I'm not entirely sure about the application process, but they are available. So if you, at the moment, if you enter medical school with a context widening participation badge, whatever, that does follow you through the course, and sometimes it can be a criteria for applying for particular things. But also at the moment, it's also a reason to get for pre-allocation to foundation programme. So this is confusing that the foundation is used in two different ways. This is the first 2 years of working, when at the moment it's students, graduates are allocated to a job on what's called a preference-informed allocation. So you basically say where you want to go, and you rank under all the various programs in the various areas, and then hopefully you'll get your preference, but you won't necessarily. Whereas at pre-allocation, if you've got a particular reason to be in a particular area, then you'll get pre-allocated that area, so you won't have to go through the preference-informed allocation process. So it can have that advantage later on.
Yeah, I mean, at St Andrews, it certainly wouldn't be identified to you in an educational setting or to your peers. This would be private, confidential information that is with you. But so don't worry in terms of information sharing that perspective. But it can have the advantage when it comes to job allocations at the end, because it's considered again.
Just to add on to that and echo what's been said, but also with our partner scheme at Newcastle, like Alison mentioned in the presentation, you do a week summer school, so that can be really helpful to meet people on the course before you start university in that September, so that could be a good advantage.